Perfect. So, yes, this is station number 1. No references for this station. Okay, it's built on your professional knowledge. So it's like one of the nice stations that we have. So who will be the lucky first candidate today? Who's gonna be first? Nizam, you will take station number 2 and 3, okay?
Okay.
Okay. So we need a candidate, guys. You can raise your hands. Yes, you can raise your hand, Azza, and you can, so yeah, you can unmute yourself.
Okay, hi.
كيفك يا عز؟
الحمد لله.
Alhamdulillah. Okay. So are you ready?
Yes.
Perfect. So here we go. Nizam, will you be watching the time, please?
Yeah, sure.
Okay, for this station, as the considering that there is no references or something, you can start directly to the 7 minutes. Okay?
Okay.
Okay, Azza, let's go.
Yes. Okay. Okay.
Okay, let's go. First station. Here we go. You have a patient profile. 7 minutes
Okay.
starts. Yeah.
Go.
Yes, hi. I'm a caregiver here in this residence, and I have a question for the pharmacist.
Okay, sure. My name is Azza. I'm the pharmacist on duty. I would be happy to help you with that.
Yeah, thank you so much. So, it's like 6:30 p.m. now, and I have one of my patients, Mr. Joe Biden. He's like 75 years old, and I was away all the day long, so he didn't take any medication, none of his medication for today. I would like to know, so his like we serve his medication in a blister bag, and I would like to know if I can give him all the medication now or not.
Okay, sure. I would be happy to help with that. Just
Next dose
give me a
supposed to
couple.
be at 7. Yeah, his next dose supposed to be in 30 minutes at 7 p.m.
7 p.m.
Mm-hmm.
Okay. Okay, just give me a couple of minutes to revise, to check this out, and I will get
Yeah,
to
yeah,
you
take your
back.
time. Sure,
Okay.
sure. Yeah.
Okay. Thanks for waiting. Just to make sure, he missed levothyroxine at 10 a.m. and also he missed metformin at 10 a.m. and 2 p.m. Is that right? And clonazepam at 10 a.m. in the morning.
Yes, he missed everything for today. As mentioned, he didn't take anything.
Just 10 a.m. and 2 p.m. only.
Yes.
Okay.
Yes. The morning
Okay.
and
Regarding
the morning and the afternoon dose.
yes. Okay. Regarding risendronate, he can take it in another day because it's once weekly. So and supposed to be taken on empty stomach first thing in the morning. So he can take it tomorrow. Okay, and resume and once weekly the same day.
Resonates, it will be
Yeah.
tomorrow. Okay.
Yes.
Here we go.
Okay. Also regarding calcium, he can take it. He can take it at 7 p.m. No problem.
7 p.m. Okay. Sounds good.
And metformin dose, he can skip it and take 7 p.m. dose.
He will take only one today.
Yeah.
So he's taking usually 3 tablets per day.
Yeah.
So he will take only
Yeah.
one at 7, right?
Yes, and if possible, you can check his blood glucose, monitor it.
Okay. No problem.
Okay.
So what if I don't know? So after I check it, should I give him another dose or only one?
Okay.
Just to make sure, you said calcium, he's gonna take it at 7, right?
Okay.
Right?
Yeah, right.
Okay, perfect. And for metformin, we will give him only the dose of 7 p.m. Correct?
Yes.
Yes, okay. So what else?
Um,
Any other thing?
Regarding rabiglinide,
2 minutes.
also he can take 7 p.m.
Okay,
Just
so this, he's gonna take it at 7 p.m. Only one dose as well for today. Okay. Okay, sounds good.
okay. Also skip. Don't double the dose of clonazepam.
What do you mean?
Clonazepam, he missed the morning dose, so don't double it at bedtime. Just give him the one dose at bedtime.
Okay, so we're gonna skip this dose.
Yes.
Okay, okay, sounds good. So we'll keep this only. Perfect. Yes. Any other thing?
Okay, I'm not sure about the antidiabetic medication generally. If you would like, I will get to you back after check this out to
Yeah, we'll
consult
get
my
what?
reference. After I consult my reference, and I can give you my opinion regarding ribaglinide.
Yes.
Ribaglinide.
What do you, oh yeah, what do you recommend in that? You told me to give him only one dose at 7, right?
Uh,
Is there any other option?
that's for metformin. But ribaglinide, I didn't mention it because I'm not sure. Actually, I would like to consult my reference, and I can get back to you.
Okay, so ribaglinide is not sure yet.
Yeah.
Okay,
Time.
time over. Okay.
Yeah.
Okay, Azza. Sounds good. I have some comment for you, but let's first get like the station with another colleague. No, let's retry it. Let's retake it, guys, with another colleague. Thank you, Azza, so much. I'll get back to you after. Yeah.
Okay, can I do it?
Yes. Whoever wants to do stations, guys, please raise your hand. Okay, so who are you, my dear colleague? Mona?
Yeah, Mona. Yeah, hi, how are you?
Yeah, Mona. We had Abdul Hadi, I think. He was raising his hand. You can keep your raising if you would like for next.
I don't know from where to raise my hand. I tried to find it.
No problem. Okay, so yeah, Abdul Hadi, you can, if you would like
It's
to
okay.
take the next station. So please keep your hand raised. Okay. Mona, let's get started right away.
Yeah,
Nezam,
sure.
please watch at the time, please. Okay,
Okay.
here we go. So
Go ahead.
I'm a caregiver here in this residence. I have some concerns about one of my patients, Mr. Joe Biden.
Yeah.
He's 75 years old. His file here in the pharmacy, guys. So you serve him his medication in a blister pack, and honestly, he didn't take none of his medication for today. He skipped the two doses, the early morning dose and the afternoon dose. And it's his next dose will be like in 30 minutes at 7 p.m. And he's scheduled as well for another dose at bedtime at 10, 9 or
Oh,
10, something like that. Yeah. So I would like to understand how it will be working with his medication. Should I give him
sure. I'm
all the
one of
stuff?
the pharmacists here in the pharmacy. Please have a seat in our private area so we can discuss this your patient medication.
Yes,
Uh,
thank you.
yeah. And thank you for coming for our pharmacy for your concern. May I ask you a few questions about your patient? His name is Joe Biden, right? And his age is 75.
Yes, correct.
Yes. And can I ask you a few questions about his medical condition?
Yeah, sure. Go ahead.
Yeah. I see here in his profile that he's taking anti-diabetes medication like metformin, and he's diabetic, right?
Correct.
What about his diabetes? Is it controlled?
Yes, it's well controlled.
Okay. And what about the last reading? Did you check his blood sugar today?
Today, no, not yet.
Okay, that's great. And I can see that he is taking the medication as a blister pack.
Yeah.
As you say that he missed 2 doses. So I will start one by one to do his medication, to reset his medication. I will start with levothyroxine. He missed the morning dose, so he can't take it next day. He can skip the dose and text at next day. Regarding the metformin, he can
We'll
take
take only
2,
one. We'll take only one
y-
to tomorrow.
only
One
one, yeah,
tomorrow.
only
Okay.
one.
Okay. This is for
Regard,
the okay.
for levothyroxine. Regarding the metformin, he can take
Yes.
2 tablets at 7 p.m. and 1 tablet at bedtime.
Okay.
Also,
Tablets at
clonazepam,
7, 2 tablets
yeah,
at 7 and 1 at
7 and
bedtime.
1 tablet at bedtime.
Okay.
Regarding clonazepam, he can skip the 10 a.m. Dose, just take the tablet at bedtime.
Okay.
Calcium and vitamin D, he can take it at 7 p.m., no problem.
Okay.
And ribaglinide, he can take 1 tablet at 7 p.m. and 1 tablet at bedtime, and skip the 10 a.m. dose.
Yes. Okay.
Also,
So we'll take only
trazodone,
2 for today, right?
yeah, he will take only 2 for today. And regarding the trazodone, he can take it at bedtime, no problem. And risodronate also, he can skip today. He can take the medication next day, no problem for that.
Tomorrow.
Yeah, tomorrow.
Okay.
And the ferrous sulfate also, he can take it at 7 p.m. as regular. And zopiclone also at bedtime.
At bedtime.
That will
So
be
I will
fine.
keep the same.
Yeah, keep the same. And
Okay.
also, just I want to ask you a few questions. Did Joe Biden take his meals today?
His what?
His meal? His
For today? Yeah,
yeah.
of course.
Okay, that's great. Okay. Do you have any question for me for now?
No, I think yeah, I'm gonna go like that and check
Okay.
everything.
Okay, thank you.
Okay, so just
Few,
make sure that we're gonna
yes.
skip the dose for today's dose for the
Yeah.
levothyroxine, correct?
Yeah. Yeah.
For metformin, we're gonna give him 2 at 7 p.m. and 1 at bedtime.
Yeah.
clonazepam, it will be only one at bedtime, correct?
Yeah. Yeah.
Okay.
Correct.
Calcium, it's gonna be 1 at 7.
Yeah.
2
Ribaglinide,
minutes.
ribaglinide will be 1 at 7 as well.
Yeah, and
1 at 7
bedtime,
and
huh?
1 at bedtime, correct?
Bedtime, yeah.
Trazodone, it will be 1 at bedtime. Quetiapine, we didn't say anything about it, right?
Okay, you can take it at 7 p.m. It's no problems. It's
7 p.m. Okay.
yeah, as indicated, yeah.
Lisdronate will be tomorrow.
Yeah.
Ferrous sulfate will be 7 p.m. Zopiclone will be 9 p.m. And naproxen,
As when needed.
so you
Yeah, if he
you
needed,
some
yeah,
orders.
he can take it at 7 p.m. If
At
he
7
need
p.m. Okay.
yeah, if he need naproxen.
Okay. He take it every day, by the way.
Oh,
naproxen.
okay. Okay,
Okay,
he can
that's
take
gonna
it,
be
yeah,
okay.
at bedtime or at 7 p.m.
'Cause
whenever it's needed.
you serve
Yeah,
him in a blister bag. So he
yeah.
would take it. I take it. Okay, he skipped the dose of
Yeah,
the.
because
Take that twice
naproxen
daily.
it is without the it is not within the blister pack, right? Naproxen.
It's in the blister bag. That's what
Yeah,
I'm
but
saying.
because it is as needed, so
I don't
how
know.
it is?
You serve him in a blister bag.
Yeah. Sorry, this is a wrong. This is our mistake. I apologize. Naproxen shouldn't be put in the blister bag because it is as needed. I will inform our staff about this mistake, and I promise that this will not be happen again. And I will remove naproxen from the blister bag.
Okay.
Yeah. And do you have
Okay.
any other
So
question?
he wasn't supposed to take that every day, right?
Yeah.
Okay.
So it shouldn't be
Okay.
yeah, served with the blister bag.
Okay. Thank you
I
so.
will remove it from the blister bag.
Thank you so much.
Time
Okay.
out.
Thank you. Thank
Time
you.
out. Okay. Time.
Thank you.
Okay. Perfect. Thank you. Okay, Mona. Thank you so much. Thank you so much for. Yeah. You did very good. You did very well, by example. Okay. So yeah. I like it so much the way that you ask in for the medical condition. Okay, so you asked about his medical condition, which is very good here.
Thank you.
I wonder why you didn't ask for like eating habits or something.
Yeah, I ask only about his meal, and that's what.
Yes.
Yeah.
Without eating
Actually, yeah, I decided to ask this question, but okay, yeah, we should,
Okay,
yeah,
so
because he is taking
okay,
anti-diabetes.
so
Yeah,
let's go step by step here. Okay,
yeah.
you didn't ask about the allergies. This is not
Mhm,
like you asked only about the medical
mhm,
condition and something,
mhm,
but you didn't ask about the eating habits. Okay,
mhm,
and I'm gonna tell you why
mhm,
you should have asked for that. Okay,
mhm,
this one Centroid. Okay, you manage it very well. We
mhm,
can postpone the dose for tomorrow. My question is, for
mhm.
tomorrow's dose, can we give only 1 or 2 tablets here? Can we
I
double?
guess one. Yeah, one
Can we
tablet.
double tomorrow's dose? Dose
I
for
don't think
tomorrow?
so.
What do you think?
No, we can skip one dose, no problem with the thyroxine without doubling the next day dose.
Okay. Perfect. Okay. Only one dose. ST Stelling. Okay, only one dose. Okay. There were some references, guys, who recommend that you can double the dose. If you missed one
Mhm.
day's dose, you can double it next day.
For
I saw
thyroxine.
this reference.
Oh,
Yes, but it's
okay.
not like this is not like mandatory or obligatory
Mhm,
recommendation for everyone. Even your action here is correct. You did well in that. Okay, you
mhm,
can postpone the dose and that's it. This would be fine. Skipping one dose is not like a big deal. Metformin, you recommended 2 tablets here and 1 tablet at bedtime. But why you double the dose at 2 at 7 p.m.? I didn't understand.
Because he took also, you said that he took his meals, he eats well. So I don't know, because the metformin will not cause also hypoglycemia if he double the dose. Maybe
No,
he may experience some side effect like GIT.
It will not cause any hypoglycemia or something, but you no need to double the dose. That means so you can take, he can take only 1 7 p.m., 1 bedtime if you would like.
Okay.
And that's it. Skipping 1 dose, 1 tablet per day is not like will not cause any diabetic complications. You get me? But two tablets together is I don't know. I don't know. It's not like the ideal option here.
Yeah.
1 p.m., 1 7 p.m., 1 bedtime. This would be fine. Okay. For clonazepam. Clonazepam. Yeah. Okay. For clonazepam here. Here the guy is taking clonazepam and you didn't ask for an indication, correct? For the clonazepam.
Yeah. I just go for I didn't ask for indication, only for that's his diabetes. So should I ask also for levothyroxine, for clonazepam, trazodone?
Levothyroxine is like
it's known.
There's no other indication, but for clonazepam, there's so many indications. It could be like a sleeping pill. It could be for anxiety and etc. Okay, the indication here is supposed to be for anxiety. Okay. Another thing that you're supposed to ask for is the eating habits. But the guy drinks alcohol here. Okay, between 7 and bedtime, he drinks alcohol. Okay, and he like consumes about 2 to 3 cups. Okay, this was a trick here. Okay, for clonazepam, you have to understand that first you had to ask for the indication. Is it for what for? The caregiver would have answered you that this is for anxiety, and I believe the guy will be like agitated today because I was away all the day. I may need to give him 1 dose today to make him like right away to calm him a little bit. Okay. At the same time, he's like drinking alcohol, and he's supposed to drink like a lot of alcohol today because I wasn't watching him today and etc. But anyways, like what I need to say here, indication for clonazepam is very important, especially at this old age. 75 years old, has taken clonazepam, he's taken zobiclone, he's taken trazodone, and quetiapine.
A lot.
So you have to ask for that. Okay, this is the first thing here. Calcium, 7 p.m. I'm okay with that. I have nothing against, but I have nothing. I have something to say with ferrous sulfate. Okay, so you put calcium at 7, ferrous at 7 p.m.
Interaction.
Okay, which is not a good action here.
We can skip, right, ferrous today?
عزوز ما فاهم أي حاجة، الحاجة دي شنو؟
Okay. مش فاهم حاجة
we
بس
can skip ferrous for today, right?
for
Ferrous
fer-
or
you can skip it or you can give it at bedtime if
or
you
give
would
it,
like. Well, usually ferrous we give it with meal. Calcium you can give it at bedtime if you would like, or you can skip it.
That's the right thing.
Ribaglinite. You give him 1 at 7 and 1 at bedtime, which is not correct as well. Why it's not correct? I need
Hypoglycemia?
the answer here. Why ribaglinite? It's not recommended to give him 1 at 7 p.m. or 1 at bedtime.
Because of maybe he experienced early morning hypoglycemia?
No. Why is it?
I think it's linked to the meal. If you skip the meal, you have to skip ribaglinide. I think that.
Correct.
That's right.
Correct, yeah, Abed. Ribaglinide,
Mm,
okay, we give it with meals.
yeah.
If you're gonna skip a meal, so no need.
Mhm.
Okay. So 7 p.m. you have to ask, he's gonna eat at 7 p.m. or not?
Mhm.
If he's gonna eat, he can take the ribaglinide. You can leave it. If not, so we have to skip it.
Mhm.
Okay. He's taking metformin, and you put as well 2 metformin at here.
Mhm.
Okay. So ribaglinide, you have to check for that. Bedtime dose is not not justified.
Mhm. Yeah,
Okay.
because no meal.
No meal exactly.
Mhm.
This could endanger his life.
Yeah, yeah, yeah.
Endanger him to hypoglycemia. Trazodone, okay, we keep it at bedtime, no problem. Quetiapine, 7 p.m. Okay, no problem as well. Risordinate, you put it tomorrow. Sulfate, good. Yes, we talked about that.
Mhm.
Okay. Zopiclone as well
Mhm.
at 7, but as well, it's recommended if he's gonna drink,
Bedtime.
if he's gonna drink a lot of
Yeah, drink
alcohol today,
alcohol. Yeah.
you can take off the Zopiclone. Okay.
Mhm.
This is as well with same thing
With
as with
clonazepam also. Yeah.
naproxen. You did the right thing.
Mhm.
Okay, it was inserted into blister bag by error. So
Mhm.
yes, we serve it blister naproxen in a blister bag twice daily,
Mhm.
while it's prescribed as in needed when needed. So you did very good here. Okay,
Yeah, thank you.
perfect.
And
Reham is
I
asking. Reham is
yeah,
asking. Just let me answer Reham first, and I'll get
yeah.
back to you. Can I give thyroxine today at 7 p.m. and after 30 minutes or 1 hour, give the rest of the medication without the iron and calcium? Also, do I need to ask about at what time he sleeps? Bravo. Very good question. This is
Mm.
important. I mentioned that as well. I mentioned
Mhm.
that he sleeps as well. He sleeps around 9 p.m., 9 to
Mm.
10 p.m. I mentioned that, but yes, you had to ask for it.
Mhm.
If more than 4 hours, can I give him iron at bedtime? Okay, very good. So let's get to the question. Can Reham give thyroxine at 7 p.m.? What do you think?
Well, I don't think so because if he took his meal, if he will take his meal at 7 p.m. So when he will take levothyroxine, it should be before meal, 30 minutes at least before meal, right?
Yes, he can take it 30 minutes before.
Yeah. Mm. Let me see because here's ferrous. We have
He can move
ferrous.
he can move his meal 30 minutes after
Yeah,
later. Like,
but yeah, he will not take ferrous sulfates. He should not take it because it will interact maybe with
not a problem.
levothyroxine. Yeah.
Okay, so one answer. Can we give thyroxine 7 p.m. or not? What do you think? Shabab,
I think
gentlemen,
early morning is better
ladies. Why? Better for what?
because it's needed for at the day, not at night. It is a
Okay,
day
but
hormone.
for what reason? For
But
what reason we give him a day?
I think I'm concerned about sleep disorder may happen at this time. I think that's why it's in the morning.
Yes, it may cause some vigilance. It may cause
Mm.
insomnia at bedtime. Okay?
Yeah.
Levothyroxine is not recommended to be taken at night or at evening because it may cause insomnia or like stimulation. It's like stimulatory medication, you know?
Mm.
This
Okay,
is why.
I have a question. Should
Yes,
we
go ahead.
consider this as a medication error or error? Should we
Which one?
this error that we put naproxen and the blister back?
Yes.
Is this considered as error?
You're
We
supposed to ask for how long he has
Mhm.
been taking this medication in this manner.
Oh, okay. Yeah. Okay.
Okay?
Mhm.
This is very important. If it's like a long duration, like 3 or 4 months, here, what you have to do, if it's like it's been like 3 or 4 months, he's taking naproxen on regular basis.
We
What
should
he's supposed
report
to do
this
here,
error, right? And ask also for his stomach, maybe if he experienced some side effects for this medication.
yes, correct.
And yeah, we should report also this report if he's taking this medication for a long time, and the error was the error took long time, like maybe 1 month.
Okay.
So yeah, so should we report this error and say that I will report this error?
Yes, you can report that, and you can advise his physician as well, as we may need to do some blood work because the patient is diabetic, he is elderly, and this could affect his kidneys.
Yeah.
Okay, so you may need to do
Okay.
blood work as well here. Okay, so
Okay,
what I
thank
need
you.
to say here, guys, drug interaction you should be aware of. Okay, like calcium and famous drug interactions. You know, like calcium and iron, you cannot put the two medication at the same time. Repaglinide, you have to understand that this medication is taken with meals. If you skip the meal, you skip the dose. Good. Here, as long as the patient is taking benzodiazepines, the major problem with benzodiazepines, always do not forget is the alcohol. Okay? What is the interaction between clonazepam or benzodiazepines in general and alcohol? What is the problem to combine both together?
Respiratory depression.
Exactly. Respiratory depression, especially in elderly patients. Okay? So clonazepam with alcohol, keep that always as a red flag. Okay? Restorative, no problem for us. Okay. Please ask for the indications as well. Clonazepam, you didn't ask for indication. Okay. Naproxen, you had to ask for indication as well. This is important.
And
Quetiapine,
how
you
long? Yeah, he's
asked for
taking. Yeah.
quetiapine. Quetiapine, you didn't ask for what reason he's taking quetiapine. Okay.
Okay.
So yes, you have to understand the case, the medical dilemma.
Yeah.
Okay. Allergies,
It's
you didn't mention anything about it.
no, I didn't. Yeah, follow the scheme.
Okay.
Yeah.
Neither you nor عزة ما سألتش خالص من الأصل على أي حاجة. Okay, you have to verify first عزة the medical condition, please, the medical problems to understand the case, and then you can step into to answering the therapeutic problem here. Okay, any comments? Well understood?
Yes.
Okay يا شباب, let's proceed. So okay, session number 2. نظام معايا.
Yes.
This is which one that نظام yes, okay, here we go.
Okay.
Yeah, if you have, guys, the reference will be, it's not, you can answer it without reference, but if you would like, if you need a reference or something, it's gonna be the CTC chapter. The CTC chapter of the BPH, the benign prostatic hyperplasia. Benign prostatic hyperplasia. Okay. If you need any references here. Abdelhadi,
Yes.
يلا بينا يا باشا.
Yes.
Okay.
Yes.
عبدالهادي
Reference
فرحاوي. انت منين يا عباد؟
المثلث
ها؟
المثلث الكبرى.
انت قلت لي كده المرة اللي فاتت صح؟
أمم.
قلت لك انت غرباوي، ايه اللي جابك الشرقاوي؟
أنا ونظام نفس المحافظة.
انت قلنا ايوه صح، قلت لي برضه نفس الإجابة دي.
تقريبا.
ماشي.
يعني مش لازم ريفرنس عادي.
لو انت
ماشي
عايز
اوكي.
ريفرنس هيبقى
CPC.
benign prostatic
CTC.
CTC. عندك؟
اوكي. ممكن افتحه اونلاين على طول.
اوكي.
اوكي. اوكي، انا شايف السي تي سي ان هم حاجتين مع بعض، lower urinary tract symptoms and PPH مع بعض.
Yes, this is the one.
Okay.
Yeah, this is the one.
Okay. Okay.
Okay.
We may start.
Nizam, go ahead and I will watch the time for you.
Okay.
يلا شباب. Go ahead.
Hi.
Hi, I'm Ahmed. I'm a pharmacist in data today. How can I help you?
Yes, hi. I just have a question for you, please. I would like to stop using my new medication for prostate enlargement. I think it's not working.
Sure, I will do my best to help you. Please have a seat in our private counseling area for privacy and confidentiality. Okay.
Thank you.
Okay. What's your name, please?
Yeah, my name is Francois Macron.
Okay, Franco. How old are you?
I'm 55 years old.
Okay, thank you. Yeah, I see your file here. I see some medications. So your concern is about the medications that you used for prostatic hyperplasia?
Yes, you're right.
No, that's right. Yeah, I see it here.
Mhm.
Okay. Okay, I may be able to help you, but I just need to ask you a few questions before going through your concern, okay?
Yeah, sure. Go ahead.
Okay, first of all, may I know why you need to stop this medication?
Yeah, I feel like it's not working.
Okay. And how are you taking this medication? How many tablets you are taking every day?
Just one tablet once daily.
Okay. Okay, and I see you are taking now since 1 month, right?
Yes.
Okay. Do you have any side effect with this medication? Like,
I don't know, but when I started using this one, I feel like I have a problem with erectile dysfunction.
yeah, I'm sorry to hear about that. Yeah. Okay. Um, I will take note of that. And I see that you are taking another medication. So I see, just for to check your medication, it's metformin 500 milligram. Are you still taking this
Yes.
medication?
Yes.
Okay. And is it your blood sugar is controlled or not?
Yes, it is.
Okay. And the second medication is rosuvastatin restore. You are taking one tablet once a day. Is it correct?
I am, yes.
Okay. You are taking this for cholesterol, right?
Yes.
Okay, okay. And I see you are taking paroxetine 20 milligram. Are you taking this one tablet once daily?
Yes.
Okay. And aripiprazole 2 milligram. You are taking one tablet once daily?
Yes.
Okay, just to make sure that your profile is up to date. Do you have any allergies?
No.
No allergy. Any other medication or medical conditions that I have to know?
No.
Okay. Okay. Okay, just give me 1 second, Francos, to check my to collect my thoughts. Okay, 1 second.
Okay.
Okay, okay, thanks for waiting. So I need to ask you more question. Sometimes a lifestyle may have effect in our health. So is it okay for you to ask you some questions?
Yeah, sure.
Okay, are you drinking any alcoholic beverages?
Yeah, I drink like two cups of beers every night.
Okay, okay, and what about smoking? Are you smoking?
No.
Okay. What about caffeine beverages?
No.
No caffeine beverages. Okay. Are you taking any over-the-counter medication?
No.
Okay, thanks for information. Give me 1 second, please, Pankos.
Okay.
Thank you for waiting, Francis. So, about your concern that dutastride is not effective with you, I would say that it's only 1 month that you have used this medication. So, I would say it's too early to judge in this medication that it's not effective. So, I would recommend that you continue to take this medication at least 6 months until you see a result with this medication. Does it make sense?
Okay.
And about your concern that you have erectile dysfunction, yes, dutastride may cause erectile dysfunction, and it's a side effect of this medication. But if you
2
feel
minutes
that
remaining. 2 minutes.
if you feel that this medication this side effect bothering you and you cannot tolerate or handle this side effect and the effect in your life, so I would say you may contact your doctor, or if you like, I may contact your doctor about this side effect, and we may see what if doctor may offer any other options at this time. Yeah, but for effectiveness, it's too early to judge on this medication. Is it clear?
Okay.
Okay, so are you going to continue with the medication, or you have another view?
Yeah, as long as you recommended this, yeah, I will.
Yeah, I said at least like few months to 6 months to see a result, and I will fax the doctor about the side effect. If you would you mind if I fax the doctor about this side effect that bothering you?
Okay. Thank you.
Yeah, and I will get back to you what's going on. So about your quickly about your lifestyle, I see. I would say that you have to cut down. I would recommend you have to cut down alcohol to like two drinks or 3 drinks every week. Um, and I see. Yeah. Yeah. So yeah. So do you have any other question about your medications?
No, thank you.
Thank you, and you have a great day.
Thank you.
Perfect. Thank you. Okay. Go ahead, Yanzo.
Okay. Okay, you did good. You asked about the medical conditions. You went through every single medication and what is this for, and is your blood sugar level controlled, and then you asked about my lifestyle. It was good as well. But just my comment here, I told you this medication is not working. I think you should elaborate more. Like, it's not working like what? What is the issue? So
Yeah,
how
right.
did you know it's not working with you? So I
Yeah,
would
right.
explain more. Well,
Yeah,
I still have bothersome frequency and urgency in the evening. So I would explain more how it's not working with me. So
yeah,
okay, then you will go and do your assessment as you mentioned. This medication takes time to give a full effect. May take up to 6 months to judge the medication, as you mentioned. Okay.
mhm,
But you need to help the patient as well. The patient is actually suffering. They will not
yeah,
be able to wait for like 6 months to get a full effect from the medication.
mhm,
So you did a good thing by faxing the doctor, but you have only faxed the doctor regarding the side effect, which is the erectile dysfunction. But you haven't mentioned anything about controlling the symptoms, how to control the current symptoms, because you can't leave the patient like this. So the patient now has two issues. The first one is the symptoms of PPH is not improving, and the second issue is the erectile dysfunction, which could be a side effect of dutastride or a side effect of paroxetine 20 milligram or aripiprazole 2
yeah,
milligram as well, because all of these medication can cause sexual dysfunction.
yeah,
So your question regarding the sexual dysfunction should be for how long have you been using paroxetine and aripiprazole? If the patient is stabilized on this medication for a long time, so it um, it seems like this side effect is not because of the antidepressant medication. It's mainly because of the new medication, which is the dutasteride. Okay. So you would confirm, okay, you know what, I believe the side effect is mainly because of the dutasteride, because this medication may decrease the level of the hormonal, the male hormone in your blood and may cause sexual dysfunction. So my recommendation is to go and see your doctor, speak with him regarding your issues. I can fix him as well regarding the two main issues you have right now. So the doctor may prescribe another medication for you to control both of your problems, the erectile dysfunction and the benign prostatic hyperplasia symptoms, like tadalafil 5 milligram, which is a medication used once daily to control the urinary symptoms and also to help with the erectile dysfunction. And you can use this medication along with the dutasteride. So I believe it should be answered like this. So you have helped the patient with his two main concerns. I feel like you have only helped the patient with just one main concern, which is the erectile dysfunction. And it's not clear as well. It's not clear like answer. How are you gonna help him with the erectile dysfunction? And you didn't help him at all with the urinary with the benign prostatic hyperplasia symptoms. You know what I mean?
Do you mean that it may be like non-medical measures or something like that, or?
It's not non-medical measures. It's just the patient needs another medication, and for that he needs to be assessed by the doctor. So I would recommend referring the patient to the doctor without stopping using the dutasteride for further assessment, so the doctor can prescribe something else for him along with the dutasteride, which will be the tadalafil 5 milligram. Tadalafil 5 milligram here will help the patient with the benign prostatic hyperplasia symptoms, which is the frequency and urgency, and will help him as well with the erectile dysfunction, which is caused by the dutasteride. Okay, so you need to mention this.
Something short term, yeah.
Yeah. I would recommend to go back and see your doctor because you need to be assessed for the symptoms you have at the moment and for the erectile dysfunction you have as well. The doctor may prescribe something for you to control your benign prostatic hyperplasia symptoms and also to help you with the erectile dysfunction issue. There's a medication which can help with both. Okay. And I would actually fax the doctor as well regarding the problem you have at the moment, so the doctor will have a good picture about your condition when you see him. And that's it. Okay, and you missed one more point. I told you I take 2 glasses or 2 cups of beers every night. If you check the therapeutic choices, the non-pharmacological choices in CTC, one of the main advices here, if you can check it, advise patients with problematic nocturia to avoid caffeine-containing beverages and alcohol in the evening. So you can mention this to the patient. If you have to drink beers or alcohol, I would recommend to drink this one in the morning, not in the evening. And try to avoid drinking any liquids at least 3 or 4 hours before bedtime to decrease the instance of nocturia or the need to go to the bathroom at night.
Yeah, I just said cut down. Yeah, I just said I would recommend that you cut down alcohol, but I didn't mention in the evening or in the morning.
Yes. Yeah, just mention to take this one in the morning. Okay.
Okay.
Yep. That's it. But you did really good.
Thank you.
Okay.
Yeah.
Did he recommend anything for the erectile dysfunction?
He didn't mention a specific product. He just said I will fax the doctor regarding the erectile dysfunction issue you have.
Okay. But okay,
But
it would be better if you
think
have mentioned that. It would be
yes.
better if you have mentioned that, you know?
Yes. Yes. Yeah, you're right.
Yes.
If I were you, I would actually recommend I would say it like this. There is a medication that can be used for the erectile dysfunction and for the benign prostatic hyperplasia symptoms. and can be used along with the dutasteride. Okay, but you need to discuss this with your doctor first. I will fax the doctor as well regarding this, okay, and about the conditions you have, so he will have a good picture about your condition when you see him.
I just have a comment on this because I would like to recommend medication. As I said, doctor may prescribe a medication X for your, because it's like if doctor didn't prescribe that, or doctor, because I had this situation before, and doctor called the pharmacy and he asked the pharmacist, yeah, just ask for assessment or further assessment, because the patient insisting to have this medication and it's not compatible with this case. So you know,
Yeah,
so
you are not forcing the doctor or anything. You are just giving the patient another option. Instead of stopping this medication, there are other options that can be used along with this one, just to help you control your symptoms. And the doctor may prescribe the thing for you. It's may prescribe, not has to prescribe or something. He may prescribe something with for the erectile dysfunction and for the symptoms as well. There are some options available. I would fax the doctor regarding your condition, and you have to see him for a further assessment. But
without
do not
mention,
stop using without. Yeah,
without
you don't have
mentioning
to
the
mention
medication.
like a
Yeah,
specific medication. And even if you mention there's a
okay,
medication called Tadalfil, it's not wrong. It's still right answer.
yeah,
It's the best solution for the patient here is to use this medication for his
yeah.
problems.
I mean generally, not this case
You can say,
specifically. I mean generally.
yeah, you can say generally, and even if you say the name of the medication, it's okay. You are not forcing the doctor, or you are not telling the patient, go and ask the doctor to prescribe this stuff for you. No, you will tell him, go and be assessed by the doctor, and do not stop using the current medication, the dutasteride. It takes time to give effect, and you may need something else besides the dutasteride. It would be the doctor's decision, and that's it.
Okay. So is it any? I put the patient at risk or misinformation in this case?
No, I think you did good. This is my
Maybe
only comment.
marginally solved, maybe,
Yeah,
or
I would say, yeah, I would say marginally solved, yeah.
yeah.
Because you only covered the erectile dysfunction part. You didn't cover the urinary, the benign prostatic hyperplasia symptoms part. The main concern the patient came with. You have to cover both.
Okay.
Yeah.
Thank you.
Okay. تمام.
مش عارف في حد عنده سؤال، عنده تعليق، حد شايف إجابة بطريقة تانية يعني.
أي أسئلة دكاترة؟ Any questions? طيب. Let's proceed. Station number 3. Okay, for this station, we will have over-the-counter medications available on the table.
Okay. I think this is mine as well.
Yes, Habibi.
Okay.
Okay.
Okay, who would like to do this one, guys, with me?
Who's next? Who's next, يا شباب? Hmm? مفيش حد؟
عبد الهادي عزة. We can choose someone. Okay, what about هبة؟
يلا بينا.
Okay. Simon.
Perfect. So, yes, Simon.
Hello? Hello.
Hello,
Okay,
You heard me?
Simon. Okay.
Yes.
Yeah. Okay. Would you like to do this one?
Yes, I tried.
Okay. Let's do it. Okay.
Azza, you did the first
So
one already, right? Is it
yes,
you or another Azza? Hey, yes, huh?
yes.
Okay.
So
So if
we'll
we
do
if we
this
don't
one
have
with
anyone else,
Simon.
yes, Azza can go. Anybody else?
We have Simon. Yeah.
Simon, would you like to proceed?
Yes.
Okay. So let's go for Simon.
Okay.
Azza, yeah, you can be next, please. Okay. So let's go.
Hello, my name is Simon.
I will watch the time for you, Nezam.
Okay.
Excuse me.
Thank you, doctor. Yeah.
What do you say?
Yes, of
Hello,
course. Thank you.
Okay.
hello.
So you have a station and you have over-the-counter medications on the table. Okay.
Okay. Okay.
Okay. So here we go. Let's go, Nezam.
Okay. Hi.
Hello, my name is Simon. I'm a pharmacist here. How can I help you?
I'm here to pick up my medication, please.
Okay, sure. Have a seat. All the information will be gathered to be confidential. Can I confirm your name and date of birth? Or
Yeah,
or
sure.
your
My name is Justin Trudeau. I'm 27 years old.
okay. Which medication do you want to pick up? Which one?
Yeah, I'm here to pick up my Celcept and tacrolimus.
Okay. Okay. Give me 1 minute to review your medication.
Yeah.
Okay. Okay. Did you take it before? Yes, I found
Yeah,
it.
actually, I took these two medications like 3 months ago, or I think 100 days ago. I don't remember. Yeah.
Okay, why use this medication?
For liver transplantation.
Okay. Okay, there are any side effects with this medication?
I don't know. I stopped using them like 3 months ago. I felt like I don't need them. I was feeling good, but I think I need to use them again.
Oh, okay. What happened to want to decide to return back this medication?
Yeah, I feel like I have some abdominal pain and nausea and vomiting. Feel like I'm not feeling good. So I think I should go back and use my medications.
Okay. Did you tell the doctor when you stopped this medication?
No.
Okay. Okay. But now you have a symptoms like as you mentioned, fatigue, body pain. Yes or no?
Yeah, I have abdominal pain and nausea and vomiting. Yes, you're right.
Yes. And there are fever.
No fever, but I feel like my urine is not good.
Yes. Okay. I
The
understand.
color.
Yes, I understand. It's hard time for you.
Yeah,
Yes.
thank you.
So, okay. Okay. Do you have any reference for that?
Do I have what,
Oh,
sorry?
no reference. We have only
No
medication.
reference, no.
I personally, I want to refer you to emergency because I suspected about broken your muscle and emergency symptoms because this medication also reduce your immunity, so it not have to stop this medication without asking the doctor, and return this medication without also asking the doctor. It is not the right decision, so have to go now to emergency to more assessment for you and more lab work for you to find it what happened in your kidney and the liver, and according to that doctor decide maybe continue with this medication or change it or it changes the dose, so up to the doctor. So right now I can could help you to call for emergency for you. Do you mind to call to help for that, or you can go to the
Is
emergency?
this an emergency condition?
Yes.
Okay, I can go by myself. It's okay.
Okay. And do you mind I call you tomorrow to check what the doctor tell you?
Sure, yeah, thank you.
Okay. Have a good day.
Yeah, I have also a question for you, please. I have some bone pain, and it's been like this for I think 2 months or 3 months. So I was actually looking for an Advil or Tylenol for this. What do you
Yes.
recommend, or topical preparation? Anything?
No, because I want to rule out any severe broken of your bone or muscle. So this is medication. It not will be helpful too much. So if you decide this your decision to go to the emergency, so no this medication is weak for this you. So maybe I recommend it for you Tylenol, but I not suspected it will be help too much.
2 minutes
So
remaining.
I the best thing for you to go to the emergency to make a more assessment for you to know what is the cause for that. Because 2 3 months ago is too long for long time to do that, and because you have a liver transplantation, so I think go to the emergency is good decision for you.
Okay, okay,
Okay.
I will go.
Okay. Okay.
Thank you.
Thank.
Okay. Thank you so much.
You're welcome.
So,
Answer.
yeah. Nizam, what do you think? If you believe that we can retake it or you can assess it, it's up to you.
Yeah, okay. I think you did go to the doctor, but I think we can take another one as well.
Okay.
Yes.
Okay. Okay, I think Dr. Azza is very, very
Azza, يلا بينا.
determined to do it. Okay. Go, Dr.
Hi.
Az.
Hi, my
Hi,
name is
how are you?
Nezam, the pharmacist on duty. How can I help you today?
Yes, I'm here to pick up my medications, please.
Okay, sure. I would be happy to help you with that. Is it for you or for someone else?
Yes, so it's for myself, yeah.
Okay, can I confirm your name and age, please?
Yes, my name is Justin Trodo. I'm 27 years old.
Okay, may I call you Justin?
Sure, yeah.
Okay, so Justin, here is your profile. Do you mind to go through it together?
Yeah, sure.
Okay. Okay. From your profile here, you are taking mycophenolate and tacrolimus and prednisolone.
Yes.
Can you tell me why you are taking those medication for?
Yeah, I took them after I had my liver transplanted 6 months ago, I remember, as I remember, yeah.
Okay, I see, and I'm really sorry to hear that you are going through this.
Thank you.
I see here that the last refill was 100 days ago. So, are you stopped taking this medication, or what happened?
Yeah, to be honest, I stopped using them because I was doing really well. So I thought I don't need them anymore.
Okay. Did your doctor know that you stopped your medication?
No.
Okay. And just to make sure there is nothing is going on, do you have any symptoms or do you feel do you have any okay, can I know why you are won't refill after 3 months?
Yeah, I think I'm not feeling well at the moment. I have some nausea and vomiting and some, abdominal pain. So I don't know. I thought I should start using them once again.
Okay. For how long you have been having these symptoms for?
Yeah, I think maybe like 1 week, for 1 week now.
Okay. And are you currently taking any over-the-counter medication or herbal supplement?
No,
Okay. Do you have any kind of allergy?
no,
Okay. Regarding your lifestyle, do you drink alcohol?
no, I don't.
Do you smoke?
No, I'm not.
Okay, thanks for answering my question. Um, I really think you should see your doctor as soon as possible, preferably today if you could.
Okay.
Because your doctor prescribes those medication to prevent your body from rejecting the liver that you have been transplanted. So what you have experiencing right now might be sign of rejection. So
Oh,
you should see your doctor as soon as possible to rule out that and to
okay.
see you need further evaluation.
Okay.
Yeah. Do you
So
have any
you
questions
are
so
not
far?
going to dispense the medications for me now?
Unfortunately, no.
Okay.
You need to see your
Uh,
doctor as soon as possible for further evaluation, and I think he might run a test, and so the dose might be changed, and because you didn't take it for a long time now.
okay, I see. Yeah. Okay, I have another question for you, please. I have some
Mhm.
bone pain. Okay. I've
Mhm.
been going through this like for 2 or 3 months now. So I'm looking for ibuprofen, Advil, or Tylenol, or any topical preparation over the counter for this. So what do you recommend?
Okay, did you try anything so far?
No, but it's getting worse.
No. Okay, for pain going on for a while like this, it need further evaluation. But I can give you paracetamol, 2 tablets. You can take 2 tablets, but you need further evaluation as soon as possible.
Okay,
Do you have another question or concern?
thank you.
If you don't mind, I would like to follow with you in a couple of days to see how things are going for with you and to answer any questions that might have.
Yeah, sure.
Okay.
Thank you.
Okay. Have a nice day.
You too. Thank you.
You didn't
Okay.
recommend anything?
He recommended Tylenol
Oh yeah, she recommended Tylenol. Okay, I didn't
for
mark.
bone pain.
Okay, good.
Okay. Okay. So, Dr. Az, Simon, you did really good with the assessment. Like, why are you need these medications now, and why did you stop using them before? This is a very, very important questions. But you can go further with the symptoms to confirm it's like a rejection or a symptoms of rejection. I told you I have just some nausea and vomiting. Okay, just go further. Okay, what else? Okay, is there any skin discoloration? Is there any severe upper? Where is the pain exactly in your abdomen? Is there any change in the color of urine? I helped Dr. Simon about the color of urine, but you should ask, is there any change in the color of stool? All the symptoms of liver dysfunction or liver rejection has to be asked to just make sure it's something related to the liver. You will refer him anyway because he stopped using this medication a long time ago and he needs to be assessed. But just to show the assessor that you know what you are asking for. Why are you asking these questions? You are asking these questions to roll out the liver rejection symptoms. Just to tell the assessor, I know what I'm asking for. I know these medications are to prevent liver rejection, and I'm now suspecting liver rejection. You know what I mean? So
Yes.
you need to go further with the assessment, with the questions. Okay. Then, as you did and Simon did, you have to go and see your doctor right away. But the missing question here: when are you going to see your doctor? First, when was your last doctor visit? Okay, and when can you see your doctor? I can see your doctor right away. It's okay. Go and see your doctor right away. No, I can see my doctor like in 1 month or 1 week. So I would recommend actually to go to the emergency or walk-in clinic because you need to be reassessed. Because I suspect a liver rejection symptoms, and you need to be reassessed and do lab work before taking this medication one more time. Okay, it has to be done like this. Okay, you asked about the lifestyle. It was good. Okay, and I think Simon didn't ask about lifestyle, but you need to ask about lifestyle, especially alcohol, because it's liver and alcohol can increase liver toxicity. So we need to ask about this. And the other thing is the prednisone. No one like asked about this medication. I told you I have like I'm sorry, there's like some noise in the background.
Okay, I think I will mute it.
Thank you. Okay, the patient has been using prednisone 10 milligram, okay, for like 6 months now or something, and he starts complaining from bone pain, like started 2 or 3 months ago, and it's getting worse. And one of the most common side effect of long-term use of corticosteroid, yes, you're right, like it decreases the bone mineral density. It can increase the risk of osteoporosis, especially in higher doses over long period of time. So you should mention this while you are using prednisone for a long time, so it might be a symptoms of decrease in bone mineral density or bone issues related to the prednisone. So I would actually recommend seeing your doctor regarding this as well. Do an assessment for this. You might need calcium and vitamin D to be used along with prednisone. So this has to be assessed and decided by your doctor as well. So my recommendation before taking any over-the-counter medication or resuming your previous medications for liver transplantation, I would actually recommend going and see your doctor right away. If not be able to see him today or tomorrow at maximum, I would go and see and go to the emergency. And I would document this in your file. This is very important. Ask your doctor regarding this, okay? And please, this is another very important point. Next time, do not stop using your medications without getting back to your doctor, okay? Because you can put yourself at risk like what's happening now. So do not stop your medication or change the dose of your medications without getting back to your doctor first. Okay, so documentation here, educate the patient about how to prevent this from happening again in the future. Okay, and refer the patient. Those are the three main, and why you're referring. You have to explain why you are referring the patient. Okay, so those are the three main points here that has to be mentioned to get the full mark. Okay.
Okay. One question. When I said to him, whenever been like going on for a while, it needs further evaluation. Didn't consider is a reason for referral?
Yes, you did right. But just ask more questions about the symptoms to show the assessor that why you are asking such questions, why you are referring him. Okay, because you haven't used these medications for a while.
Notice that prednisolone. I didn't notice that, but just I mentioned it.
This case may come with reference or without reference, but by the way, it's a real case. We saw it in the pharmacy. It was just like this. And the patient came again with a new prescription of Cellcept and tacrolimus with higher doses, and prednisone with a higher doses, and calcium and vitamin D as well. And the doctor will see him again in, I think, 1 week or something to repeat the lab work. And he's 22 years old, by the way, as well. He's not very old patient, he's young patient. It may come with reference or without reference. You did the right thing, you referred him, and you give the reason, okay? But just ask more questions about in the assessment, because it might be this nausea and vomiting something else. You will not give him the medication anyway, but it might be this nausea and vomiting related to something else. So you can refer him to the doctor, not the emergency, to get his prescription refilled or written again. But there is no need to refer him to the emergency because you do not suspect liver rejection according to the symptoms. But if you go deep with the symptoms and you feel like, no, these symptoms are liver rejection symptoms. No, he can't wait. He has to see the doctor right away or the emergency right away. So the assessor now knows why are you forcing the patient to go to the emergency or to see the doctor now? Why not wait like for 1 week or 2 weeks until he can see his doctor? Because you believe these symptoms are for liver rejection, not for something else. You know what I mean?
Yes.
Yeah. That's why you need to ask more about the symptoms of liver rejection. Just cover it all. Then you will decide he has to see the doctor now or he has to see the doctor after a few days or 1 week. It's okay. He can wait now. He can wait until he can see his doctor, or he has to go right away and see his doctor. In either cases, you will not give him the medication, but it's just like to refer to who and when. Is it urgent condition or he can see the doctor whenever he can? Yeah, just like this. Yeah.
What about
Yes.
paracetamol recommendation?
It won't help him. It will not help him because it's medication related problem. It's a bone issue related to the prednisolone. So Tylenol wouldn't help him with this problem. He needs calcium. He needs vitamin D. He needs to be assessed for this.
And if there's a liver rejection, so
Yes,
Tylenol
it's
is
another
maybe
point.
toxic, right?
You're right. It's another valid point. Yeah, you're right.
So she can recommend the maybe topical if he
You
is
cannot
suffering
recommend
from pain.
any of the over-the-counter guys. You
Yeah,
cannot recommend
you're
any.
right.
You cannot
right.
recommend any.
And always, yeah, as Dr. Mohamed said, in any referral cases, especially to the emergency or to the doctor, do not recommend anything. Go and you need to be assessed because you don't know what is happening in the patient's body right at the moment. Yeah.
Yeah, because this is like a serious case. The guy is like he has a liver injury. It's not only liver injury, it's liver transplant. So the situation is like critical. That's why you cannot give any medication till he gets assessed by a medical evaluation.
Yes. I think Rasha doctor is asking what are the liver rejection symptoms?
Liver rejection symptoms. It will be the old liver failure symptoms. You know what is the symptoms of liver failure?
Yeah.
Anybody knows? What are the symptoms of liver failure?
Abdominal pain, nausea, vomiting, dark urine.
Yeah, dark urine. This is good. Yellow skin, exactly. Yellow eye
Abdominal pain.
as well. Jaundice, perfect. He may have some ascites. Yes, correct.
Yes.
That's it. He may have like swelling in his legs as well. Swelling in legs because of the low albumin. When he got liver injury, his liver cannot sensitize the albumin, so the albumin goes down, and that may cause swelling in his legs and ascites as well. Okay.
Yeah, it's a very important case, by the way, without any further explanation. Very, very important case.
Yeah.
كده يا دكتور failure الكيس دي.
لا أبدا.
You give Tylenol,
بالعكس.
which is actually you're
It's
supposed
just about
to
giving
say.
Tylenol, yeah. But you did the right thing. You referred the patient.
He got a problem. He has a sign of the liver liver problem.
Yeah, it's
Tylenol is like hepatotoxic medication.
Yes,
By the
yes.
way, the safest painkiller for a liver patient is Tylenol, acetaminophen. Although
yeah.
it's metabolized by the liver, but you cannot give anti-inflammatory like Advil, like Voltaren or something. You cannot give that to a liver patient. You know,
Yeah,
the safest will be acetaminophen.
yeah. It will just be the dose, the maximum dose here. If his liver patient would be like 2,000 per day.
Okay,
Okay.
perfect. So
Okay.
I hope this case is clear. So the prednisone, he's taken. Is the bone pain could be related to the prednisone dose? What do you think?
This is not
Long-term
high dose.
prednisone, yeah.
It's not high.
This is what? Not high dose.
Yeah, that's 10
What is the
milligrams.
definition of high dose? What is the definition of high
Yes.
dose? At what point we can consider giving like calcium, vitamin D, maybe biphosphonates?
Yeah.
40
At
maybe.
what dose? Hmm?
When the patient is taking more than
40.
15 milligrams for about daily for about 3 months, or 7.5
What's the
milligrams.
dose? What's the dose, guys?
Mm.
14?
15 milligram daily for 3 months.
15 milligram daily for 3 months. Okay. Is it
40.
15?
Is that correct? Is it correct?
No, it's not correct. It's 7.5
40.
for 3
7.
months.
Oh, and I said 7.5 earlier.
7.5 for 3 months.
Yeah.
This you can consider of 3 consecutive 3 months. In some references, they're not so they don't have to be like 3 consecutive 3 months for over 12-year period, 12 months period. You know, but at 7.5 and up for 3 months, you can consider calcium vitamin D. اوكي. المعلومة دي أنا فاكرها من 2018 يا شباب وأنت
Sorry, can you repeat that again? When did you say we can consider calcium and vitamin D?
7.5, 3 months.
Okay, thank you.
7.5 and higher for 3 months. This will be the threshold dose above which you can consider calcium vitamin D.
All right, thank you.
Okay, it's very conservative dose by example. It's very conservative dose. 7.5 is not considered a high dose, but according to the recommendation guidelines, yes, we can give calcium and vitamin D. They will not hurt, you know. So you can consider them. So, anyways, you have to recognize the dose here. 7.5 for 3 months. You can consider calcium, vitamin D, and osteoporosis prevention. That's it. Okay. So the bone pain that the patient suffers from could be related to prednisone, which requires further assessment and evaluation. Okay. So far, so good.
Okay.
Okay. Next. Oh. What is the dose to be considered immunocompromised and duration? 2 weeks and dose? No, I didn't mention 2 weeks, guys. It's not immunocompromised. Sorry, I didn't get the question. What is the question? As long as the patient's taking cortisone, his immunity would be like lower than the normal guy. Okay, even for 1 week. During this week, while he's taking cortisone, his immunity is compromised a little bit. You got me? But if the patient is taking cortisone on a long term, like for all the day or something, and this moment, even at any dose, like at 5 milligrams or something, At 5 milligrams and above, you can consider him immunocompromised. Okay. Okay, but here we are not talking. We're not talking about the immunosuppression. We're talking about the prophylactic approach for osteoporosis for a patient who's taking corticosteroid. This is a different scenario.
I think she's talking about the adrenal suppression after taking prednisone for more than 2 weeks. I think she means this. Because yeah, the adrenal submission, when we take like higher doses of prednisone more than 2 weeks, we have to taper down or gradually decreasing or gradually tapering the prednisone until we stop it. Yeah, this is for higher doses over two weeks or something. Yeah.
3 weeks.
2 weeks, yeah. Yeah. It's
3
like
weeks?
the 2 weeks, yeah.
Okay, it's
I
2
think
weeks,
it is
guys. Yeah,
like
for cortisone, we taper it after 2 weeks.
After 2 weeks, yeah.
If the patient's taken a duration of 2 weeks or something, that's you can taper within 2 weeks. You got me? So if for example, if the patient is taking 50 milligrams for 1 week or for 5 days, for example, you can taper as well 40 milligrams for 2 days, 30 milligrams 2 days, etc.
Yeah, like the Bell's palsy treatment, yeah.
Exactly.
Yes.
Okay, so station number 4.
Okay.
Who's next? Who's next?
Let me try.
I will let you try. No problem.
Okay. So I will take care of time.
You have you have a reference. I'm gonna share you the reference here. One moment, yeah, Shabab. One moment, yeah, Shabab. Wait, here we go. Are you on the Telegram group?
Yes.
Perfect. What's your name?
You mean on the Telegram group?
No, your name.
Yeah. Oh, okay, Abimbola.
Okay. From Nigeria?
Yes.
It's Nigerian name.
How do you know?
I know. I have so many Nigerian friends.
Oh, that's good to know.
And I know you're from the football players as well.
Yeah, you're right.
There we go.
Okay, so I have to go back to Telegram to check, right?
Telegram, yes, I sent you already the station. It will be station number 4. You're gonna find the reference. Here we go. So I'm ready when you are. Nizam, can you please keep an eye on the time?
Yes, sure, yeah.
Let's start.
All right.
Okay.
Hi, my name
Okay.
is... Okay.
Let's go. Yes. Go ahead. Yeah.
All right. Hi, my name is Bimbo. I'm the pharmacist on duty. How may I help you?
Yes, actually, I'm looking for an over-the-counter medication for my hemorrhoids. It's very painful recently. I don't know if you have any recommendation for me.
Oh, sure, I can help you with that. Please have a seat in our private counseling area. Everything we'll discuss today will be kept confidential.
Yes.
Can I have your name and age, please?
My name is Angela Merkel, and I'm 37 years old.
All right, Angela. I'm very sorry to hear about the pain you're currently experiencing. I'll do my best to assist you, okay?
Yes, sure.
All right, just to get a better picture of what you're currently experiencing, is it okay if I ask you a few questions, Angela?
Yeah, go ahead.
All right, can you tell me more about your symptoms?
It's very painful. It's painful like around my rectum.
All right, and how long have you been experiencing the symptoms?
It's like a long story. It's about 1 year now.
Oh, Okay.
And I have like a anal fissure as well.
Okay.
That's it.
And is your doctor aware of this pain?
The doctor is what?
Is your doctor aware of this?
Maybe, yes.
Okay.
Maybe he's aware of this. He knows my diagnosis about hemorrhoids
Okay.
and anal
And
fissure.
okay, and are you currently taking any medication or for this?
I tried a lot, the anosol preparation H and etc. Yeah, but it helped a little bit, but you know, it's the pain is still there.
So sorry to hear about this. Okay. So far, have you tried anything to make it better? Hello?
Did I try anything to make it better?
Yes, for this present condition that you have, the painful
I use like some warm passes.
Okay. And did it okay? And what do you think is making this hemorrhoids worse?
Constipation, when I got constipated.
Okay. And you said you've had this for about 1 year now.
Yeah, exactly.
Okay. All right. Just a few more questions, Angela, for me to be able to better assess you today. Do you have any medical condition I should be aware of?
Yeah, all is in my file.
Okay, so I see on your profile that you're currently taking irbesatan, amlodipine,
Correct.
and yeah, is that for blood pressure?
Yeah, I'm a blood pressure patient.
Okay.
And I have
And
Lisocrim, the suppository.
oh, okay, yes, I can see it. And is your blood pressure well controlled?
Yes, it's good.
Okay, I see on your profile that you have no known allergy. Is that up to date?
No allergies.
Okay. And I also see that you're currently taking celecoxib. I'm sorry, date of
Yeah,
last name.
I take it from now and then for pain.
For pain.
I
Is
take
it for
one.
the
Yeah,
same
I
pain?
take one.
Oh, okay.
Yeah, for any other pain, like for sometimes I got muscle pains.
Oh, okay.
Sometimes for rheumatoid, for the hemorrhoids, I use it sometimes. It
Oh, okay.
helps a little bit. Yeah.
Okay, I see. And I also see an assault which was last filled. Oh, okay.
Point,
And I also
yes.
see, yeah, and I also see
Okay.
xylocaine. Okay. All right. A few more questions. Have you noticed any bump protruding from your rectum area, Angela?
You know, like bleeding?
Yes, any form of bleeding?
Sometimes it bleeds. Sometimes, not all every time. But it's like a long story, as I mentioned. Yeah, I have a long story with hemorrhoid. Sometimes
Okay.
bleed, but now there is no bleed.
No bleed. Okay. Have you noticed any pain when you defecate?
Yeah, when I constipated, yes, definitely.
Okay. And any blood in the stool?
Not really a blood, like some traces maybe. And
Okay,
I
when
don't
you wipe, you
understand.
see blood. Okay. And have you noticed any protrusion from your rectum area, like a bump coming out?
Yeah, sometimes, yeah.
Okay.
This is as well as normal.
Okay. And do you usually require assistance to like put it back in?
Put what?
Like to push the protrusion back, like replacements.
Yeah. Not
Few
every time.
minutes.
No.
Okay. All right, just give me a few minutes. Let me look into my reference, Angela, and I'll give you an appropriate recommendation, okay?
Take your time.
All right. Thank you so much for waiting.
Okay.
So Angela, I have a concern about some of the symptoms you just described. And that includes the bleeds you've noticed when you wipe your bum area. So I think it's really necessary for you to see your doctor So in that case, to answer your questions, I wouldn't be giving you Anusol. I wouldn't recommend that you take Anusol HC today, but I think it's really necessary for you to see your doctor right away. How soon can you see your doctor, Angela?
You know the Anusol in my file?
Yes, I can see it. And the last yes, I can see the Anusol, but because of the symptoms you just described, I think it's
Okay.
necessary for you to see the doctor. How soon can you see the doctor, Angela?
It's about this one is suppository, it's not cream. Is that gonna help for my anal fissure as well?
It will, but because of the symptoms you described, because of the bleeding and the pain when you defecate, I really want you to see your doctor.
Okay.
Okay, so in the meantime, I can give you
No
some
problem.
self-care measures that would help you. I'll
Yes,
advise
please.
that you take enough water, as this would help improve your bowel movements. And it's also important that you shouldn't strain while defecating. Okay, and whenever you have the urge to go to the washroom, please do that as soon as possible. Do you have any questions for me, Angela?
Thank you so much. Thank you.
Do you have any questions for me?
Thank you so much.
Okay.
Thank you
Is
so
it okay
much.
if I give you a call tomorrow just to know the
Yeah,
response of the doctor?
sure.
Okay.
Sure.
All right.
No problem.
Thank you for coming to the pharmacy. I'll give you a call tomorrow.
Thank you so much.
This was tough. I don't know how to
Yeah.
approach it.
What?
Time.
What did you say?
I said it's tough. I didn't really know how to approach it.
No, it's not tough. You did very well, but you didn't solve it. I have a
wasn't sure.
comment. I have a comment I'm gonna tell you later. It's like
Okay.
a critical comment. But
Okay.
yeah, I'm gonna tell you later.
Okay.
Okay, here we go. So very well. Thank you so much, Abimola. Yeah, you did really very well. Your assessment was amazing. Okay, and
Thank
Yes.
you.
that's like the advantage of Nigerian guys here. They speak English very fluently. You know, I admire your English very much. Okay, so anyways, we will move with another colleague to retake this station, and I'm gonna let you know my comments on you, Abimola, after. Okay.
Okay.
Who's next, guys? Who wants to take this station? He wants to step up and take this one. فين ولادك يا مصر؟ فين ولادك يا مصر؟ عبد الهادي الغرباوي اللي عامل نفسه شرقاوي. طيب عندنا سهى ما جاتش قبل كده. تعالي يا سهى. عزة وعبد الهادي ما شاء الله عليكم، يعني انتوا متحمسين. برافو عليكم. Soha, yeah, Soha, you can take this station. Can you please unmute yourself? Soha?
Okay. We can start now.
Yes, one moment.
Yes. Okay.
One moment, please. Yes, I'm gonna let you know now.
Hello.
Let's
Yeah.
go. Yeah, Nizam,
Yes.
time?
Okay. Yeah. Go.
Very good. So yeah, let's get started. Yes.
Okay.
Yeah, I need a recommendation, please. I'm asking for the pharmacist opinion about like over-the-counter medication or anything for my hemorrhoids.
Okay. So just to be able to help you in an appropriate way.
Yeah.
So may I know your name, please?
Angela Merkel.
Okay. How may I address you, Angela? Angela is okay?
37 years old.
Okay. Okay, Angela. Do you mind to step in our consultation area? So anything we're going to say will remain confidential.
Okay, good.
Okay, have a seat, please.
Thank you.
Okay, just before recommending anything for you, I need to ask you a few questions. Is that okay for you?
Yeah, sure.
Okay. Do you have any medical problems that I should be aware of?
It's all in my file.
Okay. So are you pregnant or breastfeeding?
Yes, I have just known that 5 days ago.
Okay. Okay. So regarding your symptoms, can you please tell me what do you exactly have?
It's rectal pain. I have like a previous diagnosis of hemorrhoids, but
Okay.
I got like anal fissure recently as well from 3 months or something.
Okay. Have you been evaluated by your doctor for the anal fissure?
Yes, he's aware of.
Okay. So do you have any other symptoms like
No.
fever,
Fever? No, no,
abdominal pain,
no,
bleeding?
no.
Okay. So do you have constipation?
Yes, sometimes, yeah.
Okay. So regarding the pain, when do you encounter it?
All the time, since 2 days.
Okay, so it's not only at the time of defecation or sitting down, but you
Yeah,
have it
it's
all the
worse.
time.
It's worse. During defecation,
I
it's
see. Okay.
yes.
Is there anything that can increase your pain?
What do you mean? You will give me something to increase my pain?
No, no, I don't. I want to know if there is any aggravating factor.
Yeah, it's a constipation, as mentioned.
Okay. And is there anything that you notice that can alleviate your symptoms or improve it?
The warm passes, maybe, and the anti-inflammatories.
Okay. So have you tried anything for your hemorrhoids?
Yes, I tried so many medications, even the over-the-counter one, and I have a suppository in my file.
Okay.
I used to take it, but it's like it helps sometimes. It gives like temporary relief. Afterwards, the pain comes back.
Okay. Sorry to hear that. It must be very stressful for you.
Yeah.
Okay. Regarding the piles, does it come out or it is always in its place?
Sorry, I didn't get it.
Do you have protrusion? I mean, the
Yes.
hemorrhoids. Yeah.
Yeah.
And you need to put it back or it return by its own.
Sometimes, not, I don't remember. Sometimes, but it's like normal one.
Okay. Thanks for answering my question. Just give me a couple of minutes to go through my reference and I will get back to you.
Go ahead.
Okay. Okay, thanks for waiting and thanks for answering my questions. Angela,
Yes.
I've noticed from your file that you are on amlodipine.
Mhm.
Okay. For how long you have been on it?
2 years.
It is okay, 2 years. I can see. And since you started, you started to get constipation, or you didn't notice that?
Is it what? It causes constipation?
Did you started to get the constipation with the initiation of amlodipine, or you didn't notice that?
Maybe yes. It could be.
Okay. Just one more question came up. Can you tell me about your lifestyle,
Yeah,
your diet?
I'm taking healthy food. I'm eating healthy food.
Okay, and exercise.
I walk.
Okay. Okay, that's good. Then,
Yes.
based on what you said and my reference, I can tell you that maybe the constipation can be contributed by your medicine, home medicine, amlodipine, and also pregnancy can increase constipation. Okay.
Yes, maybe.
So, yeah, from my side,
What should I do?
yeah, I suggest for you to go for your doctor
Okay.
because you're pregnant, number one. Number two, because the piles, when it comes out, you need to put it back manually. So this may need a surgical intervention. So you have to go back to your doctor. Okay, just
Why?
from my
This is not like a new one. It's a long story. It happened very
yeah, I can understand that, but you have to go to your doctor.
What he
From
will
my
do?
side, yeah, from my
What he
side,
what's he gonna do? Because he knows that. Okay.
yeah, your doctor would be the one to help you with that. But from my side, I can just give you some lifestyle measures to help you with your constipation. Okay.
Okay. Can you fill my suppository? The hemorrhoid
Okay.
suppository one?
Okay, I have to check if it is. No, I'm sorry, I cannot give you because you are pregnant. And also, I suggest for you to go for your doctor as soon as possible to revise your medication. Some of them cannot be used during pregnancy. So you need to be evaluated for that. In addition to solve
Yeah,
your
I'm gonna take an appointment and we'll go like next month or something.
no,
1
you
month.
have to go immediately, please. Not
Time.
only because of the
There's no
hemorrhoids, but
availability. I cannot do it. He's not
okay,
available for 1 month.
okay. Maybe there is out of our doctors, you can try to get an immediate appointment. Why? Because, for example, this medicine, irbesartan, is not recommended to be used during pregnancy. So it's really important to see your doctors because he may change it for you for more safer drug during pregnancy. Okay. And advise
Okay.
you.
Next month I will go. No problem.
No, Angela, your health is very important,
Is it
and
time,
it's,
Nizam, you told me?
excuse me,
Yes,
Time is over?
time out. Time
time.
out.
I'm over.
I
Okay.
think
Okay.
1 minute ago. Yeah.
So what yeah, final word, what would be your recommendation here?
Go to your doctor. Their treatment need to be changed. And from my side, I cannot offer her any over-the-counter medication because she's pregnant and her hemorrhoid is severe. So over-the-counter medication will not help her.
Okay. What do you think, guys? What
And
do
it's
you
the
think
only thing I
Noah's
can offer.
recommendation? What do you think was Noah's recommendation?
Maybe I can offer her isbagalahash or methyl cellulose for the constipation, just to help her with the constipation, but nothing more I can do.
Yeah, to give her what?
Laxative. Bulk
Active
for
like what?
laxative.
Which one?
isbagalahash or methyl cellulose.
Besides cellulose? The fibers?
Yeah.
Oh, you're gonna give her fibers. Okay. 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 So No problem. Thank you, Suha. I'm not like a big fan of referring. One moment, guys. I have to mute it. Yeah, I'm not like a very big fan of referring all cases or any case to a physician. Okay, so you're not doing your job like that. For this case, there is no need for referral, guys. Why would you refer? What would you refer this case? I don't understand, honestly speaking. Why should we refer it?
But severe hemorrhoids, what you will do for severe hemorrhoids?
I repeat that. I repeat every time that it's a long story. It's not a new story. The guy understands, the physician understands the story. Nothing new here. What is the progress? What is the evolution of the disease here that happened that will make you refer her to the physician?
Maybe
What
he
you mean?
needs surgery. And moreover, her home treatment medication need to be changed because she's pregnant.
Did you check the reference, guys?
Yes, it's not.
What says? What the reference says?
It's about nifedipine rectal, or is in nifedipine rectal ointments.
Did you send reference for this case?
Yes, you did.
Where is it?
It's in the group, and that's what I told you.
I'm not in the group, that's why.
Here we go. Nifedipine rectal ointment for anal fissure and hemorrhoids in Winpick. Okay. And you will find how it works and what is the advantage. What is nifedipine? Okay, and what is the advantage and etc. Okay. So you have the solution in your hand. You cannot prescribe nifedipine, but you can propose it.
Okay.
That's it. So it's not, there is no evolution in the case, in the medical
Doctor, this is OTC.
No, it's not OTC. This what I'm saying. You cannot prescribe it, but you can propose it to the physician. Okay? You can propose it. Yeah, one of the proposals that you will do is to propose nifedipine. Because she tried every single medication for her hemorrhoids, correct? She tried the over-the-counter and she has this suppository one, and nothing helps, correct? So what you will do recommend. That's why you have the reference. You have the solution here. Solution is to recommend nifedipine. Is nifedipine will be fine in the pregnancy or no? What do you think?
It's safe.
Yes, no problem in nifedipine. This is the
Yes,
first
safe.
thing. Yes. This what concerns the anal fissure and the hemorrhoid case. Okay. Afterwards, we will turn over to the current prescriptions. She's taken irbesartan and she's pregnant. Okay, so what do you think? You are insisting. I don't know why you are insisting to refer her. There is no need to refer. There's no need to see the physician here. You just mentioned the word. I told you I will be there next month. So I will take 30 days. Then I will go to see the physician. What will be the alternative from your side, like a pharmacist? Okay.
For irbesartan?
The alternative is to propose to write a fax. You have so many. You can call the physician. You can send a fax with your recommendation and advise him about the new pregnancy. Okay, that's it. The pregnancy is not like a medical urgency. Okay, so what you will do that. Okay, no problem. I would recommend you to keep an eye on your blood pressure and stop the irbesartan for now. And I will try to get an answer from your physician within 2 to 3 days maximum. I will fax him and I will try to call him by phone. If not, if I didn't get any response from him, I would strongly recommend you to go to the hospital to get a new prescription or to see another doctor or try to contact him, etc. That's it. Okay, this would be like the best answer here. Irbizartan has to be stopped. No question about it. Okay, irbizartan stopped. What will be the alternative? The alternative that you propose, the new medication, what will be the recommended antihypertensive here? What is the medication to be proposed?
Labetalol or nifedipine.
Misail doba.
Yes, you can methyl dopa nifedipine. Labetalol would be like second
Yeah.
line. It's not really not like a first line. Labetalol. Okay, but it's methyl dopa nifedipine.
But
First
she
line.
already taken amlodipine, so
What do you? Oh, okay, so what will you do here?
misail doba.
You're gonna
Doctor
stop
will
the
switch.
amlodipine. You're gonna stop the amlodipine for nifedipine.
Nifedipine,
Switch
yeah.
it for
Doctor will switch.
nifedipine. Exactly. And irbizartan, she has to stop it. Okay, and you have to recommend regular measuring of her blood pressure. Okay, so this is for irbizartan amlodipine. The suppository here. Yes.
And
Question?
silicox B, it's not recommended also.
Yes. Exactly. She has not. Yeah. She will have to stop it. If she's taking that, you can give Tylenol or something like if needed. If she needs any painkiller, you can give Tylenol. Okay, celecoxib, you have to stop it, and you have to advise her to not take it. Do not take it. Okay, for the suppository here, suppository is not the ideal one, because she has anal fissure. Anal fissure is like external one. This one is external, so suppository will not help. She has to use an ointment, or at least will be a cream. Ointment is the preferred dosage form, is the preferred pharmaceutical form for hemorrhoids or anal fissures. Okay, so suppository is not the ideal one. This is like an information for you guys.
So when do we use the suppository?
If she has internal hemorrhoids, or if she has
Okay.
like if she has as well internal anal fissure. At this point, you can propose suppository. This is a recommended pharmaceutical form. But for external hemorrhoids, because there is like there's a pulp or something internally that indicates that could be like an external hemorrhoid. At this case, or for anal fissure as well, that's external anal fissure. For these two cases, you can give the ointment. Ointment will be the ideal. Okay.
Okay. Sorry,
Xylocaine. Go ahead.
sorry, I have a question. So when you say anal fissures, that is hemorrhoids in general, right?
Anal fissures is not, no, it's like a more advanced than the hemorrhoids.
Okay, so is it divided into two types, the internal anal fissures and the external?
Yes, there's internal and external.
Okay, okay.
You
Thank
can read more about that.
you.
Yeah, in a fissure, we may ask if there is any severe scar pain. So maybe in a fissure in this case, I think.
There is severe what?
Severe scar pain on
Yes.
defecation.
Yes, exactly. It's like yeah, it's like it's a very painful one.
Yeah.
Okay. So this is the case, guys. Pregnancy, Abimola, you didn't ask about it.
Yeah, it was. I realized that
It's like a
later.
fatal mistake.
Okay.
Honestly. Yes, but no problem. We are here to learn. We are here to remind each other. So she's like 37 years old. Yeah. First question to pop up in your head at the pregnancy. Okay.
Doctor, I
So,
have a confuse about
Yeah,
something.
thank you.
you have
Uh,
what?
I want to ask some question. my scope, I can't dispense this medication. My scope not exchange pressure pills. So why not refer the patient?
Why will you refer the patient?
Because I can't dispense for her the cream in the reference, and
Okay,
also
but you
I
have you
can't.
can recommend, my dear. You can recommend. You can send a fax. You can call the physician. This would be much easier and much helpful for everyone. There's
Okay.
no need for
In,
evaluation here because she told you the physician knows the case. He knows that I have anal fissure. He knows that I have hemorrhoids. Correct?
but when I ask about red flag, about there are protrusions or more than
Red
7
flag
days.
if she didn't see her doctor or something, this
Mm,
would be a red flag. Her doctor doesn't know about the case.
Okay.
What do you mean by red flag? Red flag when you have a medication, a patient is coming for over-the-counter medication or something, and you think that this patient doesn't need any medical evaluation. You can try over-the-counter medication, can treat his case, can treat his condition.
Okay.
Ask and you screen for red flags. If there is any red flag at this case, you have to refer him. But his doctor would not have known anything about his case. You got me? But
Mm,
here, she told you that the guy knows everything. Why would you why would you refer me? He
yeah,
didn't give me
because
anything. He didn't give me anything.
okay.
He gave
So
me only I have a prescription here for the suppository and it doesn't help. So
okay.
what's your role here as a pharmacist?
So
Okay?
the better send facts for the doctor recommendation for this cream, and
Communicate.
also,
Yeah, communicate with him by fax, by phone, by anything. Yes, and propose the new medication. He doesn't know about that. He doesn't know about nifedipine. And
okay
it's
about
very common in practice, by the way. It's a very
okay
common situation in practice. You can find easily that not only every doctor knows about all the medications. Sometimes, many times, you will find yourself at the situation that you recommend treatment and you propose change in the treatment plan, etc. This is a very common situation, okay? Not every
okay.
case, not every problem. No, I am afraid I cannot take the decision. The patient will die. Is the patient gonna die if you're gonna recommend an ifidibine to the doctor or something? He's not gonna. She's not gonna die.
But when
Pregnancy
I
is
tell
not a big problem here. Irbizartan is the problem. So what you'll do with irbizartan, stop it, keep an eye on that. I will try to get a prescription. You can ask, will you be able to see your doctor very shortly, like within 1 or 2 days? She will tell you, no, I cannot. I can see him next month. In this case, what I can do, I'm gonna fax him right away and I'm gonna call him now to make sure that he receives my fax, and I will try to get an answer and check with him his opinion in your case. Because in my opinion, you have to stop the irbizartan. It's not recommended in pregnancy. That's
okay
it. You solved everything. But you kept on insisting to refer her. You have to see the doctor. You have to see the no, it's not like that.
yeah okay I
Okay?
get it. Okay, thank you, doctor.
Okay.
Sorry, one more question. If the patient mentions that whenever he wipes his bum with tissue, he sees little bit of blood, is that a red flag to refer?
The same thing. If it's like the first thing, if it's like the first sign or the first recognition of the symptoms, yes, this would be a red flag. You can refer her. If there
Okay.
is no previous, if there is no previous diagnosis of hemorrhoids, but if she has already diagnosis with hemorrhoids, and she said that's long story, and this happened with constipation, this is not a red flag. Because his physician knows, and this is normal with hemorrhoids, correct?
Okay, thank you.
So there's no red flag here. But
Wow.
if this is like the first indication, if she comes for the first time, she said that I believe that I have hemorrhoids. Why? Because there is some bleeding, there is some you don't know what else, severe pain, secretions, itchiness, or something. If you find the situation is necessitates a referral, yes, you can refer her. This would be bleeding for the first recognition of hemorrhoids. Yeah, this is a red flag.
Okay, so it has to be the first time. Okay, thank you.
Yes, for the first time. But if she has already a diagnosis, so it's what's new here? Okay, we have a question
Okay.
from ST.
Thank you.
How to know by looking at the reference that a medication, like in this case, nifedipine ointment, is OTC or prescription, please? No, nifedipine is not over the counter. No, no need. There is no nifedipine. You have to know that. Okay, nifedipine is not over the counter medication. Nifedipine is a prescription medication in all dosage form, in all
Compound,
pharmaceutical
maybe
form.
compound, I think.
Yes, it's compound. This one is compound, yeah.
Yeah.
Compounding, but it's a prescription as well. If you check the reference, you will find this is a compounding. It's written in the reference, by the way.
So, doctor, in this case,
Oh,
we should
yes.
end it by telling the patient that we will contact your doctor regarding changing your antihypertensive medication and prescribing nifedipine for you, topical for you.
Yes, I
Is
have. Yeah, you
that
can mention that I have another option. We can try something called nifedipine. It's like a very good and effective medication. This should treat both of your conditions, the hemorrhoids and anal fissure, and etc. You can explain that. We can try this for a duration of 1 or 2 weeks, and etc. You can extract all the needed information from the reference. Okay. This is a very good
sounds
reference, by the way. This is a very good
sounds
reference, and this will help you so much in your practice as well. If the patient, this is very effective treatment, nifedipine, and we have another form of nitrates. Sometimes we give nitrates, but nifedipine is very effective one for the reluctant refractory hemorrhoids cases. You know, some cases are not getting better with the treatment, with the traditional treatment in cream. The fire, like the last resort will be nifedipine, and it's very effective. Okay, that's it. تمام.
Okay.
Okay. Any questions? Okay. So I'm gonna stop the recording, guys. I think we have a